Have you ever believed that brushing your teeth more often automatically means better health? What if one of the habits you trusted for decades is quietly working against you? And what if this mistake is especially dangerous after the age of 65? I'm Dr. Michael Harrison. I've spent more than 40 years working as a dental specialist, and today I want to share a truth that surprises almost every patient I meet. Many of you have brushed your teeth 3 times a day for most of your life. You were disciplined. You followed the rules. You did what doctors told you was right. But what if I told you that this habit, when done the wrong way, can damage your gums and even affect your long-term health? I know that sounds hard to believe. Many patients tell me the same thing at first. But this conclusion did not come from theory. It comes from decades of real clinical experience and thousands of older patients. Not long ago, an 83-year-old man named James Carter came into my office. He brushed faithfully 3 times a day, just as he had for years. Yet his teeth were loose, and he was in constant pain. When I explained the cause, he looked at me and said, "Doctor, I don't understand. I've always brushed carefully. My wife brushes less than I do, but her teeth are stronger." That question comes up more often than you might think. Every week, seniors sit across from me asking the same thing. It's painful to see a habit meant to protect health quietly cause harm instead. If you gently press your finger along your gums right now, do they feel sore or sensitive? Do your teeth look longer than they used to? These are signs many people overlook. If that sounds familiar, then what I'm about to explain matters deeply for you. Stay with me, because understanding this could help protect your teeth, your gums, and your overall well-being as you age. Let me now share one of the most important truths I've learned after 4 decades in dentistry. The first harmful brushing habit people over 65 need to understand is overbrushing. Have you ever looked in the mirror and felt like your teeth seem longer than they used to? That's not your teeth changing. It's your gums slowly pulling back. Medically, this is called gum recession, and it affects nearly 80% of adults over the age of 65. Last year, a 76-year-old man named Robert Evans came into my office. He brushed carefully 3 times a day, spending nearly 5 minutes each time, just as he had done his entire life. He told me brushing was the first thing he did every morning and again after every meal. He took pride in that discipline. Yet he was confused and frustrated. His teeth felt loose, and even mild sensitivity caused discomfort. When I examined him, the reason became clear. His gums had receded significantly, exposing the roots of his teeth. In that condition, even cold air or warm drinks can trigger sharp pain. Research I conducted with the University of Pennsylvania Dental School showed something critical. For adults over 65, brushing more than 3 times a day with firm pressure can double the rate of gum recession. Why does this happen? Because aging changes the structure of gum tissue. By your 60s, gums are roughly 40% thinner and far less elastic than they were in young adulthood. When stiff bristles and strong pressure are applied to weakened tissue, damage happens quietly but steadily. At this point, many people ask the same question. Does that mean I shouldn't brush? No. The issue isn't brushing itself, it's how you brush. I once cared for an 82-year-old woman named Emily Parker. She brushed gently once a day every morning for most of her life. Her gums were healthy and her teeth were stable. The difference wasn't luck. It was technique. Safe brushing for seniors comes down to a few key principles. Use an ultra-soft toothbrush, far gentler than standard ones. Avoid scrubbing. Hold the brush at a 45-degree angle and move it in small, gentle circles, almost as if you were cleaning something fragile. Brush twice a day, no more than 2 minutes each time. Longer sessions don't protect your teeth more. They often do the opposite. After 6 months of changing his brushing method, Mr. Evans saw his gum bleeding stop, and his sensitivity dropped by more than half. Sometimes protecting your health isn't about doing more. It's about doing it differently. You may be thinking, I've brushed 3 times a day my entire life. That reaction is completely understandable. But the good news is this. It is not too late to protect your teeth and gums. Small changes starting today can make a real difference. The second brushing habit seniors need to avoid is choosing harsh toothpaste. When you pick up a tube at the store, what usually catches your eye? Tartar control, whitening, cavity protection. Big promises printed in bold letters. For many years, I recommended strong effect toothpaste myself, but after decades of working with older patients, I discovered a troubling pattern. Harsh toothpaste can quietly damage aging teeth and gums. A 79-year-old patient named Linda Thompson taught me this lesson clearly. She had used whitening toothpaste for more than 20 years. She told me she believed white teeth looked healthier and more attractive, just like the smiles she saw in advertisements. At first, everything seemed fine, but as she got older, her teeth became increasingly sensitive. Cold water caused sharp pain. Eventually, even warm tea became uncomfortable. When I examined her teeth, the cause was obvious. The surface of her teeth had worn down significantly. As we age, the hard protective layer called enamel naturally becomes thinner. Think of enamel like the peel of a fruit. It protects what's underneath. By the age of 70, this layer is about 15 to 20% thinner than it was in young adulthood. When abrasive or whitening toothpaste is used on already thinning enamel, damage accelerates. A study conducted with UCLA's dental school confirmed this risk. Seniors over 65 who used abrasive toothpaste for 2 years or longer experienced nearly 3 times more tooth sensitivity and significantly higher levels of gum inflammation. So, what should you use instead? The answer is simpler than many people expect. Choose a low abrasive toothpaste to protect weakened enamel. Look for fluoride levels between 1,000 and 1,500 parts per million to strengthen teeth and reduce sensitivity. Sensitive teeth formulas are often the safest choice for aging mouths. And remember, more toothpaste does not mean better protection. A pea-sized amount is enough. One of my patients, Susan Miller, switched to a gentler toothpaste and noticed her sensitivity improve within just 2 weeks. Sometimes, one small adjustment brings noticeable relief. The third habit to avoid may surprise you even more. Brushing immediately after eating. For decades, we were all taught the same rule. Brush your teeth right after every meal. When I graduated from dental school more than 40 years ago, I gave that advice myself. Today, I tell my patients the opposite. A 77-year-old man named George Wilson helped change my thinking. He told me he had brushed immediately after meals his entire life. He served 38 years in the military, where discipline and strict hygiene were non-negotiable. Brushing within minutes of eating became automatic for him. Skipping it felt wrong. Yet now, even a sip of morning coffee caused pain. His teeth had become extremely sensitive, despite a lifetime of careful care. When I examined his teeth, the explanation became clear. His enamel showed severe wear, along with clear signs of acid erosion. Here's what happens. When we eat acidic foods like fruit, juice, soda, or wine, the surface of our teeth temporarily softens. If brushing happens during this window, the weakened enamel wears away much faster. Research conducted with NYU's dental school confirmed this risk. Seniors over 65 who brushed immediately after acidic foods experienced 2.5 times more enamel erosion than those who waited at least 30 minutes. So, when should you brush? The answer is simpler than most people expect. Avoid brushing right after eating. Wait at least 30 minutes, and ideally closer to an hour. After meals, rinsing with plain water or unsweetened tea helps clear residue. If your mouth feels uncomfortable, a fluoride mouthwash is safer than brushing. Set brushing routines for the morning and before bedtime, rather than tying them to meals. And after highly acidic foods, waiting even longer offers extra protection. After 3 months of changing this habit, Mr. Wilson noticed his sensitivity steadily fading. Small adjustments, made consistently, can have a powerful effect over time. So far, we've talked about 3 brushing habits that often cause harm after 65. Now, it's important to address another issue many seniors misunderstand: dry mouth. Do your lips often feel dry? Do foods seem less flavorful than they used to? Many people assume this is simply part of aging, but dry mouth is not something to ignore. It affects far more than comfort. One case from my practice still stands out. An 85-year-old man named Thomas Davis came to see me, concerned that his mouth constantly felt dry and food no longer tasted right. He asked if this was just age catching up with him, but his exam told a different story. He had severe dry mouth, multiple cavities, and a fungal infection known as oral candidiasis. Further testing revealed the real cause. His dry mouth was linked to medication he was taking for diabetes. Once his medication was adjusted, his symptoms improved, his appetite returned, and his overall condition stabilized. Dry mouth is not just an inconvenience. In many cases, it is a warning sign that deserves careful attention. Why is dry mouth especially risky as we age? Saliva does far more than keep the mouth comfortable. It contains natural antibacterial agents that help control harmful bacteria. It plays a vital role in chewing, swallowing, and even starting digestion. After the age of 65, saliva production naturally drops by 20 to 30%. When common medications are added, such as those for blood pressure, depression, or allergies, saliva levels often fall even further. That's why so many seniors experience persistent dry mouth. When dry mouth continues, problems begin to multiply. The risk of cavities can triple because teeth lose their natural protective shield. Gum disease becomes harder to control without saliva's cleansing effect. Infections, including fungal growths, become more common. Taste dulls, appetite fades, and nutritional intake can suffer. Speech and swallowing may also become difficult, quietly affecting social life and confidence. At this point, many people ask what they can do. The steps are simple but effective. Sip water regularly throughout the day, aiming for steady hydration. Sugar-free gum or candy can help stimulate saliva. Saliva substitutes available over the counter can add moisture when dryness is severe. Alcohol-based mouthwashes should be avoided because they worsen dryness. Using a humidifier, especially at night, can help if you breathe through your mouth. It's also important to review medications with your doctor, as alternatives with fewer drying effects may be available. After following these steps, Thomas Davis noticed a clear change. His mouth felt more comfortable, food tasted better, and his overall mood improved. Dry mouth should never be dismissed as just another part of aging. Managing it actively supports healthier teeth, gums, and daily life. There is one final truth that may surprise you most. Many people think oral health begins and ends with teeth and gums. But decades of experience and growing research tell a different story. Oral health is closely connected to heart disease, diabetes, cognitive decline, and even lifespan. I think of an 81-year-old man named Henry Brooks. He was being monitored for heart problems when his condition suddenly worsened. Doctors traced the cause to a severe gum infection that had entered his bloodstream and affected his heart. Once his gum disease was treated, his heart condition stabilized. He looked at me in disbelief and said he never imagined his teeth could affect his heart. Science confirms what his experience revealed. The mouth is not separate from the body. It is deeply connected to overall health. Research conducted with Columbia University revealed something many seniors never expect. Adults over 65 with severe gum disease had a 20% higher risk of heart disease and a 30% higher risk of dementia compared to those with healthy gums. What does this really mean? Oral health is not just about having a pleasant smile or being able to enjoy meals. It plays a critical role in how long and how well you live. When gum disease develops, bacteria and chronic inflammation can enter the bloodstream. From there, they affect blood vessels in the heart, interfere with brain function, and worsen conditions like diabetes. This connection is not theoretical, it is measurable, and it is real. A separate study from Harvard found that seniors with good oral health lived an average of 6.5 years longer than those who did not. 6 years is not a small number. It is time with family, time with grandchildren, time with memories still waiting to be made. So how should seniors care for their oral health moving forward? Let me summarize what truly matters. Brush gently twice a day with a soft bristled toothbrush, spending about 2 minutes each time. Choose a low abrasive toothpaste designed for sensitive teeth, and use only a pea-sized amount. Avoid brushing immediately after meals. Rinse with water first, then wait at least 30 minutes. Drink enough water throughout the day and manage dry mouth actively. Visit your dentist every 6 months, because early detection changes outcomes. Clean between your teeth using floss or interdental brushes, even if it feels awkward at first. Henry Brooks followed these principles consistently for 2 years. During that time, he experienced no further heart complications. One day, he told me he was healthy enough to attend his great-grandson's first birthday. Moments like that remind me why this work matters. These habits may seem simple, but for adults over 65, they can be life-changing. I hope what we shared today helps you and the people you care about. I wish you continued health, happiness, peace, and many meaningful years ahead. And if you found this helpful, remember to subscribe to Healthy Aging Blueprint so we can continue this journey toward healthier aging together.